And does it have any bearing then in terms of if that's happening, that's part of the process? Is there any way the patient can help mitigate that? Obviously by doing less wear, but in terms of, I'm thinking of like bone strengthening activities or bone, is it, how important a factor is it for them to think about their bone health in that equation?
We're all great advocates of maintaining bone health, irrespective of how implants survive. Far more worrying for us is the explosion in osteoporotic fragility fractures throughout the whole body. So yeah, maintaining good bone health is an integral part. Will it stop osteolysis? No. But if you have a better bone quality, if you have more in the way of good quality bone at the starting point, and you try and maintain that bone quality through your life, then you're going to end up with better options were your knee replacement to show signs of failure.
And that obviously for people viewing that comes down to combination nutrition, exercise, strength exercises, but again balancing those strength exercises between impact versus kind of isometric loading and concentric loading, and kind of doing stuff that's joint friendly at the same time.
Absolutely. Joint friendly, weight bearing exercises in the appropriate way, the correct amount of sunlight, the vitamin D, the calcium. My dietitian colleagues tell me that dairy products and milk are not the way to get calcium. The lay person thinks that cheese and milk is the way to get the best amount of calcium. Apparently that's not the case, but I'm not an expert in that field, but that was quite interesting news to me, because I think there's a...
What's the case? What would be the better option? Did I mention?
I think that the correct balanced diet is something that is very contentious at the moment. As I say, I'm not somebody to give that viewpoint. You'll get quite vociferous people who are fanatical about whether it's a dairy diet or a carnivorous diet or a vegan diet. I don't think it's for me to launch into that sort of argument. There are pros and cons, I suspect.
Loads of comments on the things otherwise.
I'm sure there'll be lots of
We won't go. Just then,
I think having a healthy diet, trying to maintain a diet that covers all of the bases. Unless you're a strong advocate of one of those particular diets, if you believe that being vegan is the way to maintain your health and bone health, and then that's fine. But for the average person in the street who doesn't really want to know too much about different diets, I think just maintaining a nice spread of dietary constituents is probably the way to go.